everyone, welcome back to my channel, Learn with Riyaa. Today we are going to learn about something very important, and that is breast cancer. So to emphasize the importance of breast cancer, I want to go over some statistics. In 2018, the United States had 254,744 new cases of breast cancer. And out of all of those cases, 42,465 women died. That is a huge number. Also, for every 100,000 women, 127 new cases of breast cancer was reported and 20 women died. That is also a big number. And the reason I share this with you is because it shows how prevalent breast cancer is in our society and how so many people are dying from it. So it is important to spread awareness about breast cancer. Before I get started with the nitty-gritty details of my presentation, I want to give an overview of what I will be talking about. First, I will be speaking about what breast cancer actually is, then symptoms and signs, risk factors, and then I will be going over primary, secondary, and tertiary prevention pertaining specifically to breast cancer. Now, in a previous video, I went over these 3 types of prevention. You guys should check it out. Another thing that I would like to add is that all of the information that I present in this video is from the CDC. What is breast cancer? Before we get to the specific definition of breast cancer itself, we should go over what cancer really is. So cancer is the uncontrollable growth and replication of cells in our body. As a result, breast cancer is a disease in which cells in the breast grow at a rate that is kind of out of control. Now, there are many types of breast cancer, 2 of them being invasive ductal carcinoma and invasive lobular carcinoma. Before we go over what these 2 types of breast cancer are, I want to go over very briefly the breast anatomy. Our breast is a gland, and it is made up of lobules. And these lobules secrete milk, which go through what we call ducts. So the invasive ductal carcinoma is a type of breast cancer which originates in the duct and then spreads to the rest of the breast. Invasive lobular carcinoma is a type of breast cancer that starts in the lobules and then spreads to the rest of the breast. So the main difference between both of these types of breast cancer is its origin. Now that we have gone over what breast cancer is, what are its symptoms and signs? One symptom is if there's any change in the size or the shape of your breast. Now, if there's any pain in any area of the breast or any sort of nipple discharge other than breast milk, including blood, then this might be an indication of breast cancer. Along with all of this irritation, dimpling of breast skin, pulling, or like just simply pain in the nipple area, or even a lump in the breast or underarm are signs of breast cancer. Along with all of this, thickening or swelling of parts of the breast, or even redness or flaky skin in the nipple area of the breast are symptoms of breast cancer. If you experience any of these signs, it is best to go to a doctor just to see what's happening. Now that we have discussed what breast cancer is and its symptoms and signs, let's go over primary prevention, or how we can prevent ourselves from getting this type of cancer in the first place. One thing we can all do is exercise regularly, because when we are physically active, we have a better quality of life. And this also reduces the chances of getting breast cancer. Also, don't drink alcohol. Alcohol has many negative effects on our body, and not drinking alcohol reduces our chances of getting breast cancer. Along with all of this, women who have just had a baby and who have a newborn baby and who are able to should breastfeed, because breastfeeding actually lowers the chances of getting breast cancer. Also, we should pay attention to genetic factors because in family history, if there have been women in past generations who have had breast cancer, you are more likely to have it as well. So it's just important to go to the doctor and get regular checkups. Lastly, if you are going through any hormonal therapy or on any birth control pill, just discuss any risks with your doctor and make sure that the benefits outweigh the risks. Now moving on to secondary prevention. In secondary prevention, it's important to be self-aware of your breast. This means knowing the size and shape of it, because if there is any problem, then you will be able to tell that there is a problem very quickly because you are already very versed and you already know the shape and size of your breast very well. Also, it is important to do self-evaluation of your breast, such as palpating it, because you will be able to tell if there are any lumps. But if there are lumps, don't panic because it can just mean that there are cysts in your breast. But if you do feel lumps, just go to your doctor to make sure that everything is okay and normal. Also, make sure to go to your PCP scans. Women who are 50 to 74 years old should get a mammogram every 2 years because as women increase in age, they are at increased risk for breast cancer. Women who are 40 to 49 years old should talk to healthcare professionals to determine when to start and how often to get a mammogram. Along with all of this, this is a picture to show a women getting a mammogram, and doctors may perform an ultrasound, MRI, or even a biopsy if necessary and needed. Unfortunately, if you do get breast cancer, there are some measures that might be taken, including surgery, chemotherapy, hormonal therapy, biological therapy, and radiation therapy. But if you do get breast cancer, don't worry too much because the survival rate for this type of cancer is very high just because of the advancements in the medical field. So fight hard and remember to live your life because everything is going to be okay. If you are a survivor of breast cancer, there's something called quaternary prevention, where you just have to keep going for regular checkups to your doctor just to make sure that everything is still okay. So this is the end of the presentation. Thank you so much, you guys, for listening. I hope you guys learned a lot. And if you did, please leave a big thumbs up, subscribe, and leave any comments, any questions, and any suggestions as to what you guys would want to see and what you guys want to learn in the future. Thank you so much for listening. And I'll see you guys next time where I teach you guys something else as interesting and important as breast cancer. Bye.